Premier Ford returned to Queen's Park after a 2-week quarantine after exposure to a positive COVID case. His first question period back was spent mainly on the defense of his Minister of Long-Term Care, Mary Lee Fullerton.
The Premier and the Minister all summer long claimed that there was an iron ring around long-term care, and everybody knew that there was no such thing, and yet nobody on the government side is prepared to take responsibility.
The Long-Term Care Commissioner's report found that the lack of planning on the government's part led to sluggish responses to the COVID virus's deadly effects on the province's most vulnerable people. Precautions like wearing masks and limiting staff to work at just one facility should have been taken sooner.
The final report shows what we've been saying all along. After years of neglect by governments of all political stripes, red, orange, and blue, our long-term care system was broken.
However, Andrew Horvath says the Blues PCs didn't help the situation when it took office 2 years before COVID struck.
This government has to take some responsibility for the cuts that it made. In 2018, cancelling the comprehensive inspections. In 2019, cutting funding for long-term care and for public health.
When Horvath demanded that Fullerton resign, Ford stood by his colleague.
She's done more as a doctor to serve those most in need than anyone in this chamber. Anyone, bar none, for 30 years.
Regardless, Andrew Horvath continued to press the Premier to remove Fullerton from the portfolio.
The very least this Premier should do is show some accountability. Fire that minister from her position.
Instead, the Premier says he will shoulder the blame.
But the buck stops with me. That's what it stops with. It stops with me, and I'll take responsibility.
The Premier then pivoted to his ongoing fight for the federal government to implement stricter borders.
Yesterday, 12 people that we know of, just going through the airport, came in with COVID. That's 12 people. Multiply that by 10 in a day if they don't stay at home. Because they aren't staying at home, by the way, Mr. Speaker. We need the federal government to stop the leak.
While cases in long-term care homes are down to single digits, the province's epidemiological report shows that 9 residents at long-term care homes died from COVID on May 3rd, and 1 person died yesterday.